Not all expensive lens has the best results because multifocals has its limitation. You need good lighting for reading. You can't have dim lighting, and there is restriction for driving at nights.
So now the golden question is cataract surgery can be cheap, can be expensive. Multifocal, monofocal, they are priced different. Now some insurance company doesn't pay the full price. What do you recommend? Monofocal, or should we go for the expensive ones, the multifocal and the hyper HD? You know, I've heard of a hyper HD multifocal cataract lens. So what should we do as consumer? Can you tell us about it? So what is cataract surgery?
All right, cataract surgery occurs when the lens opacify. Yeah, you have it online. Lens becomes opacify, and what happens is we need to remove that opacification that's occurring on the lens and replace with a clear lens, and that will help make the world seems clearer, right? And what the picture is showing is a simple cataract surgery, the modern cataract surgery, in which we use a phacoemulsification through a small wound which is about 2.75 or smaller, and implant a foldable lens which will remain in the bag where what was once your clear natural lens, but with age that needs to be replaced. So yeah, a modern surgery is a very straightforward surgery, and it's one of the most commonly done surgery in the world. With it has its own risk factor, right? But it's one of the lowest in the current modern surgery. So, but if the eye has its own problems, like it had a trauma or injury or things like that, then it doesn't become a straightforward surgery. It becomes more about a complex cataract surgery. So you need to see the doctor. An eye assessment needs to be done. What are the risk factors? What is the benefit? That needs to be discussed with your doctor.
So now, multifocal or monofocal, tell us.
Right. So 20 years ago, when lens was very simple, you only had a monofocal. And what happens in monofocal is it corrects vision at a distance. So if you are driving, you need to see a distance, and you know the plane, the mountains, the trees from the distance, it appears clear. But when it comes to reading, things becomes a bit more difficult, and you need a spectacle, a plus add spectacle to improve the vision for near, especially reading. And so a lot of the lens company has gone and invested, and they have come up with this what we call monofocal or continuous vision or things like that, in which you do not need glasses for reading, right? So you have good vision for distance, intermediate, and near. And that because lens company has invested lots of money, it's been priced as premium lens. So it's like cars. You have, you know, your premium Bentley, and then you have your Toyota Camaris, you know, or your Honda Accords and things like that. So lens very much depends on what is the person's lifestyle. All right?
Tell us.
And therefore, you need to discuss with your doctor what is your preference, and also budget. You have to tell. But I love to have a Ferrari in my drive-through garage, but you know I can't afford it. So, you know, I look at my income and I need to balance and budget a car. So same thing for an operation. For most surgeons who do cataract surgery, their rates are fixed. You are paying additional is for the lenses, and multifocal can go up to 4,000 or 5,000 a piece. However, and I say this with precautions for all your future clients and current clients, is always ask the risk and benefit. What are the limitations of the lens? Not all expensive lens has the best results, because multifocals has its limitation. You need good lighting for reading. You can't have dim lighting, and there is restriction for driving at nights, because these lenses have problems with glare and halo. So
what is glare and halo?
So when you drive at nights and you see the back
next-
lights or
This one?
and you see the lights or the street lights, they tend to have this a circular or distorted light. They are not sharp. So halos and glares can be mild, moderate, or severe. And you can see on the severe side, it is very, very difficult to drive at night if you're going to have that type of vision. And I myself had a client, a patient who came and wanted the most expensive lens. I was happy, and explain the risks and benefit and things like that. And what he didn't tell me was he was a biker. And 2 months after surgery, a successful surgery, his vision was good. He's happy with reading in my clinic, good lighting and all. But he was very disturbed about bringing out his bike in the evenings and nights, because he says he was not feeling safe to bring his vehicle out, and that's because of the glare and halos. So a lot of things need to be discussed with the patients before they implant their expensive lens or premium lens.